So my wife and I were talking and we kind of asked each other, okay, so how can we complete our 6-year goal in 6 months? So that's officially why I quit respiratory therapy. So I didn't quit respiratory therapy. I quit my job as a respiratory therapist because I'm going to travel as a respiratory therapist. So I can make about 3 times the income that I was making at my facility. Now, who knows how long this is going to last, but I figured that I need to take advantage of it. I know I made a video about a week or 2 ago talking about how I was happy where I was at and why I wasn't going traveling, but ultimately, like I said, my wife and I were talking, and many of you do know my goals, and I'm all about passive income and just potentially getting money elsewhere rather than sacrificing my time, and a lot of times you need money to do that. So that was something I said to myself was, okay, if I'm making more money, I can put my money to work in other places much more faster than what I'm doing now. So that's kind of the reason why I went traveling. And that was the #1 pro in that other video about traveling is why is traveling so great? And it's the money. So I am going to be making about 3 times as much as I was making, which is just fantastic. Which is just a huge increase. So my wife also owns her own business that we run for our house. She is a dog groomer. She still does PT on the side, however this is like our main gig. We want to make sure that we can expand that a little bit more, have more employees, have basically the business making money for us while we're not even working there that day. So that's kind of something we want to do. I talked before about rental properties, Airbnb, things along that line. Anyway, those videos are for way in the future. Right now, we're just kind of saving. But for right now, I just want to stick to respiratory therapy. So I kind of want to give you guys a little aspect of every part of respiratory. So I gave you videos talking about working as a staff respiratory therapist. I made a few videos about me being a lead. I interviewed a lead. I do want to make some more videos about being a lead and maybe why that position exactly wasn't for me. I don't think I'll ever become a lead again. Like I said, I'll elaborate on that a little bit more in the future. And then who knows, maybe in a few years you'll even see me working in NICU or with pediatric patients, because right now I'm kind of hitting all spots. Maybe you'll be in PFT, pulmonary rehab, home care, who knows. But right now you're going to get the traveling side of respiratory therapy. So I plan on making tons of videos talking about traveling, where I'm going, the places you can go as a traveler, how traveling from one state works to traveling to another state, what you may need. I'm going to talk about my pay more, if I'm staying at my house and commuting to my traveling position. I'm just going to share all that with you. That's in a future video, so make sure that you like and subscribe and stay tuned for that, because that's going to be exciting. Lots of information put out there about a traveling respiratory therapist and all the things you can do. If you want me to even interview my recruiter, I can go ahead and ask her to do that, and she can kind of give you a lot more details than I can. Well, anyway, that's the gig. I quit my respiratory therapist job at my facility. I was happy working there, however, it was time for me to go somewhere else. Like I said, I made that video about not traveling, however, something just kept eating away at me saying, Austin, do it, do it, do it. Now's the time to do it. So that's exactly what I did. I pulled the trigger and I'm going traveling. Anyway, I hope you enjoyed this video. If you have any questions about anything, or if you have any questions about traveling that you want me to answer in a future video, make sure you leave in the comments and I can go ahead and do that. Well, anyway, I hope you enjoyed this video and see you in the next one.